we see a common pattern of challenges, and so a lot of the information that was put together in this presentation was based upon real life things that we see on a daily basis with families that we're serving and working alongside. So I do hope that this information is really valuable, helpful to you. And of course, as mentioned by Sheila at the end of the presentation, we will definitely take questions, and I'll help to go deeper dive into anything that would be beneficial or helpful to you to know on this topic. The topic we're going to be talking about is navigating the senior living maze. When is the right time to move in, into what level of care? And that obviously is something that's just, I think it is like a maze when you look at the different levels of what's out there, and we see a lot of confusion. And that's me, and you're seeing me now. And here's our contact information. The community that I'm talking to you from today is in Boerne. It's called Franklin Park, Boerne. We are an assisted living and memory care community, a lovely one-story building that's been here a little over 4 or 5 years. And we are part of a larger company called Franklin Park, in which there's independent living, assisted living, memory care communities in and around San Antonio, Round Rock, even out in Dallas, we manage a community. So my phone number for the community, my email is there, and our company website. So I wanted to make sure this information was available to you. So what is senior living? Senior living is a generalized term that includes many different types of senior care and housing. Senior living communities include independent living, assisted living, retirement communities, nursing homes, care homes, and memory care. So many options can be confusing, and often families don't quite understand what each different term really means. So we're going to break it down, and I'm going to talk about each of the different levels. So we have tiers of care in a community setting. There's independent living, assisted living, memory care, skilled nursing facility, and I put the letters in parentheses because a lot of times, unfortunately, those of us who have been in the industry for a while throw out initials. And I always tell people to try not to do that, because if you don't work in that specific industry, you won't know what the heck people are talking about. You'll hear IL, AL, MC, SNF, SNF. People often in the industry will call it a SNF. That's a skilled nursing facility. A CCRC is a continuing care retirement community. So in the independent living, we're going to start there because that is really a community of residents that's exclusively for the more active senior who can live on their own. The communities include maintenance and repairs, taking away many of the burdens associated with owning a home. So that's very attractive for some people. And one of those benefits of living in an independent living community is that they allow seniors the freedom that they need to live an engaged social life. Many communities offer group meals, social activities, and group outings. Some also offer on-site services such as beauty barbershop, transportation, banking, and housekeeping. One of the things in the independent living setting that you have a lot of folks who, when they reside in that setting, most of the time what I see are people who are looking to downsize or minimize some of the challenges that they're experiencing with home ownership. So the independent living option seems to be one that works out well for many people. The next tier, I would say, in terms of when we look at the umbrella of long-term care, is assisted living. An assisted living community combines the independence of a private apartment or suite with the 24/7 support of on-site caregivers. Residents have a variety of social activities and wellness programs to participate in every day, as well as support with personal care, toileting, and medication management. Meals, housekeeping, and laundry are also included. Seniors with chronic illnesses or disabilities can benefit significantly from an assisted living home. So in assisted living, we actually see, it's interesting. We see some families who are coming, or residents who are making the decision to move into assisted living prior to having events occur. They have maybe received a diagnosis in which they know they're going to, in the future, start to need some additional support and care and services. And so they're kind of making a proactive decision to get settled and find an assisted living community that they know is going to be able to come alongside them as they have needs for support. We also find that there's a lot of spousal couples that end up moving into assisted living. We have quite a few actually here at our community, where I have a highly independent spouse moving in with their dependent loved one. So their loved one we have someone actually this week who moved in where it's a husband and wife, and the husband has Parkinson's disease. The wife is very independent, does things on her own for herself, has been her husband's primary caregiver. And so this setting is going to be a support for her. So we do see a wide range of scenarios in terms of people who are making the choice to move into an assisted living community. The next level of care is what is referred to as memory care. So when a senior has Alzheimer's disease or a related form of dementia, a memory care program or memory care community can be a safe solution. Memory care, a lot of people assume, so does that mean my loved one has to have an Alzheimer's diagnosis? And the answer is no. For someone to move into a memory care setting, they have to have a diagnosis of dementia, and there are many different types of dementia that exist. The environment of memory care is especially, hang on. The memory is especially designed for safety and security of people with dementia. They prevent common dementia risks like wandering. They reduce anxiety and make navigating easier for residents. They have caregivers who receive special training to meet the needs of adults with memory impairment. Programs and activities are provided to keep the resident physically active and engaged, and the programs can be part of an assisted living community or a separate community dedicated exclusively to adults with dementia. One of the things that we see is we don't always see the trait of wandering. That can certainly be something that occurs when someone does have dementia, but that's not the only reason why a memory care setting would be suitable. I often find families who make kind of in their mind, they're thinking, well, why my loved one doesn't wander, we're not worried about them eloping. And they think then that maybe they would be appropriate for an assisted living setting. But I think what's important to be understood is that memory care communities often have a higher staffing ratio. And so in that setting, the staff, because they are specially trained, they understand to provide the frequent touch points with the residents for queuing and for redirection. So that's the highest need of most of the residents, is that they just need that frequent touch point and redirection. And so that type of support is much better offered in a smaller setting, regardless of whether it's secure and locked or not. It's having that higher touch point with the staff. The next level of care is a skilled nursing facility. And nursing homes are for seniors who need a higher level of care than what assisted living communities or home caregivers can provide. Most nursing homes have nurses available 24/7 to provide medical assistance to residents. Typically, nursing homes offer two distinct types of care: skilled nursing and rehab, and long-term care. Skilled nursing patients come to a nursing care community for rehab with a goal of returning home or to an assisted living center. Most are transferred from a local hospital following a surgery or illness. Long-term care section of a nursing center is for seniors who need a level of medical care that isn't offered in an assisted living community. For example, IV therapy or treatment, support with a feeding tube, or support to a senior that is bedridden. So there's that kind of, I think that often I see families having a little bit of confusion in terms of a skilled nursing facility rehab. And I'll talk about it in a few slides down, where we're going to talk about actually standalone rehabs that exist, Warm Springs being an example of one. So most residents or individuals who get transferred to that skilled nursing facility for, let's say, rehab, have a certain number of days that will be approved by Medicare to be covered. Once they've extended or exhausted those number of days, then what happens is a determination will be made, sometimes by the facility, sometimes by the doctor, sometimes it's directed by the family and their wishes, in terms of, can my loved one come back home to be at home with us? Is their need for care and support greater than what I can now provide for them? What options exist for me? Do they need to have ongoing physical therapy or occupational therapy to continue to get stronger? So those are all things that most families end up having to think about if their loved one ends up in a skilled nursing facility for rehabilitation. The CCRC, or Continuing Care Retirement Community, is basically a campus setting where all levels of care are offered. So there may be cottages or small houses, independent living, assisted living, and skilled nursing, all on that campus. So the campus setting, it encompasses all of these components of the long-term care umbrella: the independent living, the assisted living, the skilled nursing, and normally they all have a long-term component of someone who might need to reside in a skilled nursing home long-term. And we're familiar, I personally have, there's one in our community that has, it's a major campus. They have cottage living, and sometimes that setting is overwhelming for some people. It's too big. It's a very personal choice. Some people make a decision early on in their retirement that they want to buy in or become a part of a campus like that. So it's just something to consider in terms of where you are, what your preferences are, what you believe your needs are going to be. So then there's other options outside of those tiers that I talked about, which is care options for in the home. So some of you may be involved in working with home care agencies. Private duty home care, or in-home care, is usually what it's referred to. So private duty care, in-home care, is also referred to as non-medical home care, is a service provided to older adults who need help thriving in their home. This service is provided by professional caregivers who are trained to help seniors maintain their personal care. They assist seniors with their activities of daily living, which include tasks like bathing, eating, and dressing. And caregivers can also help seniors with activities like grocery shopping, light housework, and transportation. And then there's still more to consider, and that is the short-term rehabilitation centers and hospice care. And so in short-term rehab, seniors who had surgery or a recent illness are often transferred to a short-term rehab center to recover. Short-term rehab centers help seniors restore their health until they can return home. Many times seniors are referred to a senior living option like an assisted living or skilled nursing facility after receiving rehab services. Home health care, which provides physical therapy, occupational therapy, and or speech therapy, can follow the senior into a community setting like independent, assisted living, and memory care. So I've personally toured Warm Springs, and what I love about their facility is how highly specialized they are in their efforts to really help that patient who comes in recover from that surgery or from the illness they've had. They have specialty equipment like the bariatric for wound care. So it's highly focused, and their goal is to help people get stronger and better. So the short-term rehab is not really, I included it because I wanted to touch upon it, but it is not a long-term care option. It's a short-term thing that you can touch upon, but we often see patients who come out of that short-term rehab setting who are then making decisions about, again, am I going to return home? Is home the best option for me now? Do I need to consider an independent living? Do I need to consider an assisted living? Or are my care needs at a place where I need to be in a skilled nursing home, a skilled nursing home? Hospice care is a partner type service. It's a type of healthcare that focuses on the palliation of terminally ill patients' pain and symptoms and attending to their emotional and spiritual needs at the end of life. Hospice care prioritizes comfort and quality of life by reducing pain and suffering. Hospice care provides an alternative to therapies focused on life-prolonging measures that may be arduous, likely to cause more symptoms, or are not aligned with the person's goals. Hospice is an added layer of support that may be provided in an independent living, assisted living, memory care, and a skilled nursing facility setting. In our community, we have several hospice partners that we work with, and it is a wonderful added value service that can come in alongside what our community is already providing to help a loved one who is in a position where they are 6 months to a year from end of life. And the part of it that I think is especially wonderful is not only the nursing support that they receive, but the spiritual component of the chaplain services. And I've seen it be very effective as a support, not just for the person, the resident, but also for their family members. So those were many different types of senior care options that I just described. And so it can be very overwhelming and can cause seniors and their families to avoid exploring long-term care options until they are in the midst of a crisis. Waiting until you're forced to decide makes the process far more stressful than necessary, and it can also limit your ability to decide where you live post-retirement. So there are some pros and cons to consider when you look at all of these different options. One of the ones that really we see that has stood out, and it's been very interesting with COVID. We've had a unique perspective as being a long-term care provider on the health and well-being of our residents who have lived with us pre-COVID and stayed with us during COVID and then post-COVID. And then speaking with families who put the pause on making any decisions because of the COVID crisis. And then what we saw after COVID started lifting, the ban started lifting, and some of the results of those loved ones who were left in their homes, not moved into a facility. So I'm going to talk about that in a moment. One of the things to consider in staying in your home with home care services, a definite pro for so many families is that, their loved one, they want them there with them, and they want to be in the comforts of their own home. And it's completely understandable that that is something that is very, very important. And many times it is worth it, to make whatever arrangements and accommodations. There are home care agencies that can provide support and services. What I'm seeing right now and some of the notes that I've written here to share with you is based on what I'm currently hearing, the feedback that I'm getting, is that they are really, a lot of home care agencies are struggling to hire staff. So the caregivers may not be consistent or are likely to change frequently. I have heard recently that agencies simply cannot staff the requests that they receive. So they're getting requests to provide support to individuals, but they don't have someone to send to them. These rates that I'm giving you are ones that are rates that I've in the last few months received from home care. I called 6 different home agencies and was getting rates. And really the range that I found was between $21 to $28 an hour. And of course, there could be rates that are lower in different parts of town. There are also rates that are likely higher. So an example for 4 hours of daily care with someone who's getting that home care is around $3,120. I took kind of a middle number there, and that's the number you get for the monthly output for 4 hours of daily care. For 24/7 care, it could be a little under and greater than $18,000 a month. So that's for 24/7 round-the-clock care. So it's certainly financially something that has to be taken into consideration for families when they're looking at that potential scenario. The assisted living memory care, one of the things about the design aspect is you already have a home that's been built with the express purpose and design to accommodate a senior. So you've got the handicap accessibility throughout, including the bathroom design, having it be where if someone needs to wheelchair in and be transferred to a shower chair, all of that is available in the design in most every assisted living or memory care community. Despite the staffing shortages, the providers are ultimately responsible for ensuring that staff and resident ratios are met. So what we saw taking place here at our community, there were certainly staffing shortages and some crises going on because of the pandemic. When you have a staff, though, that's been with you for a while, you retain that core team. And so we were able to deploy some partners of agency staff to come in to fill in the gap where we didn't have, but we always brought in that extra support. Now things are actually improving, and so we've been able to eliminate having that type of support here in the community. But at the end of the day, it's that provider's responsibility to make sure the staff is there to provide the care to the residents who are living in that community. The monthly rates for an assisted living on average, and again, I'm going to say on average because I'm sure in certain parts of San Antonio, you can probably find rates less than $3,000 with an added level of care. I put the range between $3,000 to $6,000 because you can have a highly independent resident who's has no level of care, and so their monthly rate is going to be less than a resident who has a greater level of care and needs for support. Memory care on average, the ranges would be about $4,800 a month to $7,500 a month, which is providing that 24/7 care plus a lot more. The one thing that I wanted to touch upon for a moment in regards to pros and cons is funding sources. So in an independent living and an assisted living, independent living, of course, is a private pay option. We do see when people are moving into an assisted living or have home care or are in skilled nursing home, they can leverage if they have long-term care insurance. We have we see many, many people these days who do have long-term care policies that will reimburse for care, which is a great option for many people. If someone has a low income and qualifies for Medicaid, you will not find very many Medicaid assisted livings, although there are some out there, but you will find many skilled nursing homes that do have Medicaid beds available. Medicaid and Medicare is a whole nother conversation that we could talk about. I'm not going to get into that at this moment, but I just wanted to touch upon the differences in terms of payer sources for these types of care. So what's the most common thing keeping you from placing your loved one into a facility? What we see is some of these things, like my loved one wants to maintain their independence. They're not social. They don't want to live in a community setting. I promised I'd never move them into a facility. I don't know what their finances are. I don't think they can afford living in an assisted living. They're not ready to talk about it. Having that conversation for many responsible parties or spouses is really a difficult thing, as well as children who are caring for their parents. We hear they're not old enough, which we all have a perspective of our own age. When we look at ourselves, we have a perspective about what our age is. But our residents who we see coming in maybe appear like same birth year, but yet they perceive that they are just not old enough to live in a senior living community. The other thing that, again, because of this COVID, we heard a lot was, I'm concerned I won't be able to see them if there's a surge in COVID again. So there was this lockdown that occurred. But fortunately, what we've seen and what I've seen through the state is I think they've learned a lot through how they've responded to the initial COVID outbreak. And there are now many rules in place in terms of not being able to limit someone from being able to see their loved one. So there's now a much greater level of freedom and access into the community and to participate in the life of your loved one and not having to be separated and isolated from one another. What we saw happening with the COVID lockdown was many individuals, because they lived in their own home, were so isolated. Their family members were afraid to expose them to COVID, so they didn't visit as frequently. So we saw the health actually and well-being of many people living on their own greatly go down. They lost weight. There was a failure to thrive. They were completely isolated socially, mentally, not getting stimulation. And so when their loved ones felt comfortable to maybe make a decision to move them, their loved one was no longer in the same condition they were a year earlier. And what we see happen when people are in a community setting is there's a natural inclination towards interaction and stimulation. Even if you have an antisocial personality, the sheer nature of having to go to a dining room setting, for example, you're going to see your neighbors, people talk to you. There's so much stimulation that happens just through that alone. We have seen residents who have put on healthy weight, like they were maybe too thin, they put on healthy weight because they're now, you eat more when you're sitting around other people. More variety in the food that's offered. A lot of those things that were very positive for people who had been in an isolated situation and then were able to thrive being in that community setting. So when your present situation is no longer working, it's time to reevaluate, right? If we get to a point in our lives where things just aren't working out, there's a saying about that. And so you want to take a pause. And these are some things to think about, that it may be time to reevaluate. If your health as caregiver is impacted, You see your loved one is declining, your loved one is isolated, and you're drawing back. You yourself are drawing back from normal activities that you once participated in. Weight loss. I've seen weight loss not just in the person who is receiving the care, but I've seen weight loss in the caregiver, because they're not taking care of themselves. They're run down and they're just tired and exhausted. There's a failure to thrive. Safety concerns like falls. Oftentimes that's a big trigger that we often see for why a family's making a decision to make a move from being in an in-home setting. Of course, if someone is leaving the home and there are elopements, and it's interesting because we have conversations with families and they often don't want to call it an elopement. So we'll later, through time talking and working with the family, find out, oh, well, they just, decided to walk out on the golf course, or yeah, they like the neighbor's house, so they would go over to the neighbor's house. So anytime someone leaves a home thinking, not knowing where they're going, and potentially would be a safety risk, we consider that an elopement. The other thing to take a look at is, what is the stress level? Is it constant? Is it relentless? Is it getting greater? These are all reasons why I would encourage you to say, okay, maybe it's time to hit the pause button and take a look at what's going on. Many of us have had moments in our life where there was a crisis situation. What is the definition of crisis? A crisis is any event or period that will lead or may lead to an unstable and dangerous situation affecting an individual, group, or all of society. Crises are negative changes in the human or environmental affairs, especially when they occur abruptly with little or no warning. More loosely, a crisis is a testing time or an emergency. So it's really important, because one of the things that I think is important, and probably one of the greatest takeaways of this talk today, is really wanting to avoid you finding yourself in a crisis. So let's talk about some practical tips to be prepared. Number one, hold a family meeting, including all the children, before the emergency occurs. So that family meeting could be made up of stepchildren. It could be made up of all siblings. I mean, the family construct, I know for each family is unique. So you as the primary caregiver will know, who are the important people that I need to call together. And there are some questions that you can go through and talk about. What challenges am I currently facing with the situation I am in now? So talk through that.
The family really needs to have a meeting so y'all can do this decision making as a team, not just one person, the wife or the husband doing it. And I'm going to talk about the power of attorney and medical power of attorney. It is very important to designate one, because I know everybody has different family dynamics and there's going to be a lot of difference in opinions. So it's better if you designate that now, so one can be the decision maker. And especially if they're not local. I mean, one in Arizona, like that. I mean, there's a way to do it, like you all meet, and then whoever is the power of attorney or MPOA will have the strong voice, right? It's better that way than there's fights going on internally.
It is so important. The other factor that I've seen and observed over the years is the geographic location. So the consideration of if they're not local, is everyone in agreement for the geographical location where mom or dad should live? I have a personal experience with this because my mother-in-law from New Jersey her whole life. Her husband had passed away. And 3 years ago, the family all was observing that mom was just starting to decline. And so they made a decision. She moved into an independent living community because she was living in her home by herself completely. Now she had neighbors who would check in on her. She was loved by so many people. She had made the decision on the independent living, and there were some local family members who were still close by to her. So being in that independent living was working until it wasn't. And until it wasn't, when she had some medical events that took place, some frequent falls that took place, and the children all made a decision that, okay, mom needs to be probably move to an assisted living. Well, the question then came into discussion with the family, which was, well, do we stay here in New Jersey where there's no one else really too close by to her? Or is it time for her to relocate to be closer to another family member? So all the siblings, even though not all the siblings were POA, there was a desire for everyone to have a say in that, since it was such a big decision to make a move. At the end of the day, the family decided to move her. Actually, she resides in Texas now, and move her. She actually is one of our residents. But watching that dynamic, I've seen it within my own family, but then seen it in other families where they're making this determination as far as where is that geographic location where we want to live. And then is everyone on the same page? Unfortunately, we do not always get on the same page. Unfortunately, there are times, and that's when, as Melinda was talking about, at the end of the day, the person who has been designated as that power of attorney will have the ability and right to make those decisions. Another practical tip would be to talk with your loved one's primary care physician. So some things to ask: do you know what medication your loved one is prescribed? What are the health concerns? Are there pre-existing conditions, allergies? I've been surprised at families who had no clear understanding of their loved one's medical history. I'm sure in the situation with this group, you're so highly involved, you know everything that's happening, but unfortunately, we do see times where there are things going on that someone is not aware of. So if you can gather that information in advance, it's extremely beneficial. Does that primary care physician have recommendations been made regarding their care? What are they thinking? And it says talk with your PCP, but it could be that it's a specialist. If your loved one is already involved in working with a specialist, then it would make a lot of sense and be appropriate that that specialist would be involved in asking these questions.
Or what options are available. So we talked about this. Tara talked about other consideration for geographic location, proximity to certain family, because you still want to be able to visit, right? So that, and then what is the budget? So again, having a meeting, it is not expensive. Well, it is not cheap, but if we're looking at who's paying for this, is there long-term care insurance? Is do you have veteran affiliation, a vet or a wife of a vet? Because there is such a thing as personal aid in attendance, right? And then also just looking at the budget. If you live in a big house, how much does it cost to maintain living in that big house? That includes taxes and maintenance. You still have to buy food, grocery. You still have to get somebody to cut the grass, those things. And then maintaining the pool, how much is that? So you got to look at that and see, maybe it's cheaper if we move in to independent living or whatever that is. So it's not just the medical support, but also financial, right? And I know there's some that it's just too much. I mean, they cannot physically mow the lawn, but now they have to pay somebody to mow the lawn. How much is that? Does your loved one have long-term care insurance or property to sell? So this is the same thing. So just looking at, there's some people that they have long-term care insurance, but they don't even know about it. So now is the time. You've been paying all these years to an insurance company and you forgot that it is a long-term care rider, right? So now it's time to look at your paperwork and see and call those insurance companies. You never know if you have it or not. And then start asking questions like, call them, how much will it pay? How much is the daily budget? Is there a elimination period? How many days is that before it kicks in? Does it pay for people coming to the home, or does it pay for an assisted living? So things like that.
I think that having that information, again, having, I encourage families to almost have a little book with all the important information. One of the things that I guided my family to, because it was not my mom, but my mother-in-law, I guided my sister-in-laws and my brother-in-law to talk about even future things like funerals and gathering all the important paperwork. And does she have a will? And have you looked at it? And is everyone understanding what mom would have wanted? Let's talk to her. When you have someone who's able to participate in that conversation, it's really important to have those conversations and not shy away, because I think they would want to have a say in the decisions that are being made. So it's important to know what your options are, and help you to, siphon or sift down by going through this discipline. It'll help you to have, I think, get to the point where you have a practical plan. And number 4, one of my recommendations would be to request an assessment. So I see, unfortunately, sometimes families hanging on. They've made a decision. Yes, we like, for example, assisted living. That's an option we prefer. We've toured it already. We know that that's the decision we want to make in the future. But what happens sometimes is someone waits so long that when they finally reach out to us because a crisis has occurred, they call us, and then we find out what the physical state and needs of that resident are, or their loved one is. They're no longer appropriate to be in admission for an assisted living. Whereas had they moved in when they were a little bit healthier, they would move in and be able to stay in that facility. Most assisted living facilities nowadays, I don't know many that don't have this philosophy of care. It's called age in place. So you move in, and over time, your care needs change. Sometimes they change quickly, sometimes they change slowly. That community will come alongside you and provide ongoing changing care as you need additional support services added on. But if someone comes to an assisted living provider and is already in an extremely advanced stage of the disease process, it may be determined that they're no longer really an appropriate admission. So that's the part of not delaying too long if you know that this is a direction that you may be moving in. So you can talk with a community advisor. You can schedule an assessment. You can find out their thoughts on levels of care and where that person might fit in. And that's where you're also having that clarity. What would the level of care options be for your loved one? Do they need memory care? Is assisted living still appropriate? Could they live in independent living? It's only by talking to a professional who could determine and guide and help you understand where they would see them fitting in the best. The other practical tip is finding a local support group. And so kudos to each of you because you're already participating in this Neuro Support Group that provides you with current information and education and support. There are many groups, both virtual and in person, to address a wide range of specific needs. We at Franklin Park host a caregiver support group the first Tuesday of every month from 6 to 7 p.m. Our next meeting will be December 7th. And the Alzheimer's Association has a wide range of virtual support groups available for spouses, adult children, dementia specific to early onset. So if you go to the website, you can find other support group options that are available there. So, keep doing this, keep being involved and getting the support from others who are journeying alongside you. I know that unraveling the maze can seem overwhelming, but there are healthcare professionals that can help. Melinda being a wonderful example of one of them, and Sheila and the team that you've been working with. Just to give you a little glimpse into the life of an assisted living community, this happens to be our community. So since you're not with me in person, I thought I would kind of welcome you in so you could get a better idea of what we do here at Franklin Park.
Franklin Park is truly committed to exceptional care, and our personal motto here at Birdie is all focused around and centered on the word excellence. And so we strive to serve our residents with excellence, and also excellence in how we interact with one another as coworkers and teammates. This is a fun community. We like to have a good time, and I think you'll see that in not only how our team interacts with one another, but as well as how the family of the residents interact with one another. It's truly a community out here in the Hill Country, and we love it.
I love living here because the people are so caring and so helpful to me with my husband.
I like the friendships that we've been able to establish with each other, the residents have. It's broadened our lives where we feel sometimes, when you come to a facility, you think, well, my horizons have closed. Well, this Franklin Park has done a good job of making sure we open them as much as we can, and that's been a real pleasure.
I love working here, and I have to say the main reason I love working here is due to the residents. It was my desire and my need to come and work where I could actually feel like I'm making a dent, a difference in humanity.
Everything is just absolutely, I couldn't think of anything that I would ever, mildly unhappy with.
I really enjoy all the people. They are very helpful. All the workers are helpful. The nurse is great. Our food is good. And everything. Really pleased.
It's just wonderful to spend every day with them. Again, loving them, supporting them, caring for them. It's fun. It's a great place to be.
Thank you, Sheila. I appreciate that. So we're here. We're here as a provider to support you. We are, as Melinda mentioned earlier, we were thrilled when we were participating with Parkinson's, partnering and hosting Parkinson's support groups and exercise classes. I actually hope we can get back to that. Part of us having the caregiver support group in person and in our community is an effort to create more of that happening again. We have trained staff specifically in the management of Parkinson's, and we are so proud to partner with the Alzheimer's Association and provide certified dementia practitioner training for our memory care staff. We are happy to provide in-home assessments and consultation regarding placement. We also are offering respite services for memory care specifically, which a minimum stay of 14 days. So our community, Franklin Park, we are here to support you. I want to introduce to you Angela Finley. Angela has been working here at the community with me for over 3 years, and she has really, I think the hat she plays is much more as counselor and consultant with families. She spends a great deal of time really just holding their hands, understanding their dynamics, and walking them through the maze that we've been talking about as far as making decisions for, where their loved one is. So, Angela.
Thank you. Thank you, Tara. My name is Angela, and I am the Director of Sales and Marketing here at Franklin Park Birdie. My background really quick is I got a degree, a bachelor's in counseling, and then I got another degree in ultrasound. Two completely different worlds collided because my passion truly is to counsel, help provide support for people that are in need. We truly look at our community as each of our positions is a ministry. And so I'm happy when I get families in here, they will stay 2 hours, sometimes 3 hours. I'll take as long as is needed because this is a big decision, and it's your loved one's, quality of life, if not yourself. So you are welcome to call us. You've got the number. I can go do a home assessment in the home, just conversationally with you or your loved one, and then guide you as to what I believe would be the next best steps for you.
What is the minimum age limit for Franklin Park, for either or IL, AL, or memory care?
It's 55 or 56 years old.
And to back that up, there are communities that are being built. They're called 55 and over communities.
Mm-hmm.
What is that?
So those, and actually there's one that opened in our community. It's apartment living, and there's a wide range of them. So that would be in the independent living. I would put anything, if you see it's 55 or plus living community, you can kind of put that in the umbrella, in that box of the independent living. So typically those are, apartment type complexes. They're not going to provide all the amenities and care support. It's just simply that they cater to people who are probably retired or getting ready to retire, and offer typically that groundskeeping where you no longer have to care about lawn maintenance and that type of support. There's one that opened near us. It's an apartment complex, and it actually caters to low-income seniors, but it's like an apartment. You're getting an apartment. And the ability to be with other people that are of the same age bracket as you.
Your loved one has Parkinson's, and you've decided you do want to go to an assisted living. And as Tara was saying, that they had reached that just over the limit where they really shouldn't or can't be in assisted living. Can they go to an assisted living if their partner is living with them as well?
So the important thing would be what specifically care-wise is happening. That would potentially mean that they wouldn't be appropriate any longer. So that's, can you give me a specific example in terms of the care that's happening?
Maybe falling or memory, but they're currently in their own place, but after this presentation, they've decided, well, maybe this is something we should look into.
Frequent falls is very common. It's a common reason why people move into assisted living. Up to a 2-person transfer can occur. So if someone is physically limited and needs support transferring in and out of a wheelchair, for example, or in and out of a chair onto their walker, that support is available in an assisted living setting. If they have reached a place where they can no longer weight bear, which means even with someone by their side helping them to support them so they don't fall, they cannot bear weight, and it requires more than 2 people to safely transfer them, that would be a reason why they wouldn't be a good admission to an assisted living. Help with incontinence issues is certainly available. Memory care issues happening is certainly something that can be supported in assisted living as well.
So since the holiday is coming up, if you can explain, either Angela or Tara, as far as the respite care, if they want to go, the loved one want to go to out of town and wants to have a place where their Parkinson's or loved one needs to be taken care of. What is respite care at Franklin Park?
Well, so we are going to assess the resident, and everything that steps that need to take place for someone to move into our community are the same steps someone will take for respite care. The benefit of respite care is once that's all been done, for 6 months, all that information is still good. So if you leave, if you're here for 2 weeks or 3 weeks, a month, and then you're back home again and you come back within a 6-month period of time, you don't have to do that each time you come for a respite stay. But we have to gather still the same amount of information as if it were an admission. One of the things I think a lot of people don't understand either is they believe that once they've moved in, they're stuck. And it's really not true. At least in our community and many providers, it's a 30-day notice. So you move in, you're residing there, you're kind of testing the waters or seeing if this is a good fit. If you ultimately at the end of the day decide we're not ready for this, then it's a 30-day move out notice.
How much is respite care per day?
Respite is $250 a day.
All right, for a minimum of, did you say 14 days?
Yes. Mm-hmm.
Judith, you have a question?
I do, thank you. And this is actually just an advice question, because our ship has sailed, I think, as far as moving into assisted living. We went to your place several years ago, and that probably would have been the right time to move my in-laws, but they didn't want to go. We didn't feel it was like 100% necessary. We do have home care now that needs to be increased. And my question is that we're in California, they're in Texas. We're going there now because my father-in-law was in the hospital and came home on oxygen. So, you know, one of us is there 24/7 along with the home health people. But we're wondering about moving them out here or leaving them in their home. And so this is just an advice question. I felt very strongly for years that we should move them out here because we're all here. But now, having been there for 2 weeks and taking care of them, I feel like being in their own home is probably the kinder way. Do you have feelings about that? Do you have any sense of the amount of disruption that it would take to move to really elderly people? They can't be on their own and they want to be together. And one of them has Alzheimer's and one of them is a brittle diabetic. And, you know, we just are like, should we make the effort to move them out here and disrupt them, or should we leave them there and just, you know, make sure that they have the kind of care that they need?
I think that that's a very complex situation. I think first, you know, if we go back to the caregiver, taking care of the caregiver first, for your own sake and sanity, sometimes we have to make decisions that are for our own future health, ongoing health. So I would want to evaluate ask myself, how much longer can I see myself flying back and forth, you know, keeping up with this? Is the in-home care going to continue to be reliable? When you have spouses and they're not willing to separate from one another, it's very difficult. And those two diagnoses are very complex. You have someone with Alzheimer's disease and then the other one a brittle diabetic. I have had resident with Alzheimer's have their spouse move in with them in the memory care, if you can believe that. I have had that happen numerous times because they didn't want to be separated. And as a provider, we evaluate that if we believe there's not a safety risk for that spouse. Sometimes the disease process it becomes, we're concerned, for the health and well-being of that spouse without the Alzheimer's disease.
Right.
So those are things that we look at as a provider. But I would be thinking,
well, the spouse can't be alone. That's the other thing,
yeah,
that the spouse can't be alone. Neither of them
right,
can be alone.
yeah, but they both need different things.
Exactly.
So yes, they both need different types of care. So
Yeah.
one would need, like, one would be potentially needing assisted living, whereas the other one would need memory care. And there are a lot of providers in California who would certainly probably be able to provide an appropriate setting where they could still see each other, because we've had residents who, one lived in assisted living, they were married, one lived in memory care, and the spouse in assisted living would go to visit their loved one on a daily basis and eat meals with them, but then they would go back to their apartment to sleep. And so most providers will want to hear your situation and come up with a scenario that will work for you. That's how Angela and I usually try to look at the unique dynamics and figure out a good solution. But I think
we're being told right now by assisted living places that they won't accept him without skilled nursing, even though he takes care of himself and has always taken care of himself. They don't want the liability of his labile condition. So, we're kind of, I mean, there's Boerne cares, there's things like that. But my question is, do you think that moving is terribly traumatic?
A move is always traumatic. I'm not gonna say it's not. A move is always a traumatic. And when someone has Alzheimer's disease, there's something called transfer trauma.
Yeah.
And so it's a very,
okay.
So it's a very real thing that does occur. We have seen it occur. And when someone with Alzheimer's disease changes their scenario, moves into a different setting, it can create a decline in where they are. However, if you go back to where I was talking about, if what's current situation is simply not working anymore, you're gonna, at the end of the day, have to be at peace with knowing that any decision you make will likely, it's gonna be a change. It's gonna have some kind of ramification. However, once they're settled and being cared for, and there's not the added stress of trying to make decisions and constantly flying and, checking in, it would worry me if I were out of state and my loved ones had that level of care needs to rely on a home care. I mean, it make me nervous.
Mm-hmm.
And then when a crisis or someone falls and then someone's going to the hospital, well, who's got to be there? That family,
right?
So at the end of the day, having them geographically probably closer to you and your loved ones to tend to their needs, I'm sure there's a setting that will ultimately work for them.
Okay.
And Ms. Judy, this is Melinda again. I am a transitional care coordinator. I'm a physical therapist and been doing this for a long time. I'd like to offer my, if you want me to, just to see and consult. It's different. I mean, your case is so different. It's easier if we do an assessment just to see and give you recommendations on what to do.
Yeah, and I think that anything that you ultimately decide to do will be done in love. And I think that telling them, yeah. And so Melinda's offer is a great one. And she will know, she will be able to tell quickly, because she knows our community extremely well as well, to say, what, actually they could still be appropriate, or yeah, you're right, maybe not anymore. So I think having that information will be important, because then you'll actually know for sure, okay, here's what I'm going to be looking at then for finding for them.
Thank you.
It's been a great session, Tara. It's very timely, very informative. And we just want to thank you for your expertise. Angela, thank you for setting this up. Again, it's Thanksgiving next week. We are just so grateful and thankful for everyone. We've been doing this for a long time, our support group, and we are just grateful for the camaraderie and and sharing of knowledge that we're doing.